everyone, welcome to EasyNurse, where nursing education made easy. Today we are going to discuss the previous year questions from one of the toughest subject, OBG, obstetrics and gynecology. So stay focused, listen carefully and make sure to note down the important points. Let's make OBG simple and crack simple. So let's begin. Okay, now we are going to start our new section, that is give the meaning of the following. Okay, I will tell each words of the heading and below that I will explain it meaning clearly. So please listen carefully and note down the answers. Okay, so here the first question, that is tubectomy. What is tubectomy? It is a small operation that done for woman to prevent pregnancy by cutting and tying the fallopian tube. Okay, what is that? It is an operation done for the women's, that is to prevent the pregnancy by cutting and tying the end of the fallopian tube. Okay, here what is fallopian tube? Fallopian tube, it is a tube that connects the ovary of the ovary to the uterus. Okay, it is a connection and it carries egg from the ovary to the uterus. Okay, so next we are moving for the next question, that is attitude. Attitude means that is fetal attitude. What is fetal attitude? It is the position of the baby's body parts inside the mother's womb. Normally the baby bends its head and arms towards the chest. That is fetal attitude. Okay, next one, what is premature baby? What is premature baby? It means that baby who is born before the 9 months or 37 weeks, that we are known as premature baby. It means that baby who born before completing 9 months of pregnancy or 37 week of pregnancy, that we are called premature baby. Sorry. Okay, next one is ectopic gestation. What is ectopic gestation? That means it is the pregnancy that happens outside the uterus, usually in the fallopian tube. Okay, that is known as ectopic gestation. Okay, next we are going for the amniocentesis. What is amniocentesis? It is a test. It is a procedure. It is a test that how we done the test, in which a small amount of fluid that we taken from the mother's womb to test the baby's health. Okay, so it is a procedure or the test that we are using for the pregnant ladies, that is amniocentesis. Next one is precipitative labor. What is that? It means that very fast labor, that when the baby is born within less than 3 hours after labor start. If the labor start before that, the 3 hours, the baby will born. Okay, that is known as a precipitative labor. Next one is retraction ring. What is that retraction ring? It is a ridge. It is a ridge. What do you mean by ridge? Ridge means a narrow line that is formed in the area. Okay, so it is a ridge formed between upper and lower part of the uterus during the labor. If the upper and the lower part of the uterus, there will be a ridge formed between the upper and the lower part of the uterus during the labor. In the labor time only it will happen. So that is known as retraction ring. Next we are going to discuss about the third one, that is crowning. What is that crowning? Crowning means it is a stage of labor when the baby's head become visible at the opening of the birth canal. That is that crowning. It is the stage of labor when the baby's head becomes visible at the opening of the birth canal. Okay, next one is genetic counseling. What is that? It is a process where the parents get advice about the changes. So here we can see that genetic counseling. What is that genetic counseling? It is a process where the parents get advice about the changes of having a baby with inherited or genetic diseases. So that is known as genetic counseling. Next one is 10th one, Braxton-Hicks contraction. Sorry, Braxton-Hicks contraction. What is that? It is a procedure. Sorry, there is a mild or irregular practice contraction of the uterus that occur before the true labor starts. If the true labor will start, there will be a mild or irregular practice of contraction happens in this Braxton-Hicks contraction. So that is known as Braxton-Hicks contraction in the time of true labor. True labor means it is a real or normal labor that we can see. Okay, that is Braxton-Hicks. Okay. So we can go for the next one. Okay, next we are going to the fill in the blanks section. Each question carries 1 mark, so it is very important. And remember, don't waste your time writing the full questions. Just write the answers only, only the answers. Okay. So next we are going for the first slide. Dash is the dark line running from the symphysis pubis of umbilical during the pregnancy, that is linea nigra. Next one, dash is the discharge from the uterus following childbirth, that is lochia. Next one, the membranous space between the bones of the wallet of the skull are known as fontanelle. Fontanelle. Okay. Next, fourth one, that is the middle muscular layer of the uterus is known as myometrium. So if they ask, the upper layer of the uterus is perimetrium, and the inner layer that is known as endometrium. The 3 layers of the uterus is perimetrium, myometrium and endometrium. Here they ask the middle layer, so that will be myometrium. Upper layer it will be perimetrium, and the inner layer it will be endometrium. Okay, next one, the ovum and the spermatozoa each have the number of chromosomes 23X and 23Y chromosomes. Okay, next, the fusion of male and female gametes is known as fertilization. The fusion of male and female gametes is known as fertilization. If they fertilize, its next step is zygote, then the baby will be formed. Okay, next, 7th one. Violet blue discoloration of vaginal mucous membrane is termed as Jemcumier's sign. Okay. Next one. The creamy substance on the newborn baby is also known as vernix caseosa. Next, 9th one. Dash forceps is applied when the head is at or below symphysis pubis, that is Briggerlis. Okay, next, 10th one, female pelvis is also known as gynecoid pelvis, that is known as what is that? Gynecoid pelvis. Okay, next we are going for that next question, that is true or false. So here true or false also contain 1 mark questions, so it is also very important. Don't write the full entire questions because your time is very important. Okay, next we can move for the first question. Lamnoidal structure separates the frontal bone from the parietal bone. How is that lamnoidal suture separates the frontal bone from the parietal bone? No. Why? Because the lamnoidal suture separates the occipital bone from the parietal bones. The coronal suture separates the frontal bone from the parietal bones. So this is the right answer. So here it is false. Okay, next one. The reproductive period of the woman is 14 years. Is that right? Not false. It is about 15 to 45 years of the age, not just 14 years. Okay. Is the female reproductive period will be 15 to 45, not for the 14 years. Okay. Next we are going for the next one, that is next question. When the involution is impaired, it is called subinvolution. Is that true? Yes, it is true. Okay, next, estrogen is a hormone secreted by adrenal gland. It is false because estrogen is a female sex hormone mainly secreted by the ovaries. It's not by the adrenal gland. Okay, next one. The android pelvis resembles the male pelvis. That is true. Next, puerperal psychosis is known as postnatal blues. That is false because puerperal psychosis is a serious mental illness that after delivery it will happen. The postnatal blues is a mild mood changes after the childbirth, and they are not the same puerperal psychosis. It is more severe and needs a medical care. It's also needed. It's not like that. Okay. Next one, eucosia means abnormal labor. That is false. Why? Because eucosia is a process that giving birth naturally without any problems or complication. That is that. Next one, caput succedaneum is present at birth. So yeah, it's the right thing. Caput succedaneum is present at the birth. Next one, center separation of placenta is known as Matthews-Dukan method of explosion, because it's false. It's not like that. Next one, 10th, perineal care is given to postnatal mother. That is the right one. Okay, next we are moving for the write the difference between the following. Okay, next we are moving for the difference between the following. It is also important. You can write by drawing the columns, and you can write it in an attractive way. Okay, so here we can see the first question, polyhydramnios and oligohydramnios. In the poly, in the meaning of poly, that you can see that what do you mean by poly? Poly means more than. Okay, sorry. Okay, poly means more than. Poly means more than or too much, that we are called or known as poly. Oligo means little or smaller. Okay, that we known as oligo. Here the polyhydramnios means too much of amniotic fluid around the body, usually seen in diabetes or twin pregnancy, that we known as polyhydramnios. Next one is oligohydram. Oligo means it's small. So too little amniotic fluid around the baby. Here the too much little is too much. Okay. Too little amniotic fluid around the baby, usually seen in the baby's kidney problems or the membranes leakage. So you can write it in separate, in the two columns you can write. Okay. Next you can see that malpresentation or malposition. What do you mean by mal? Mal means wrong or bad or abnormal position. Okay. Presentation means it is in a wrong presentation. Malposition means it is not in a proper position. Okay, so here we can see that malpresentation and malposition. Okay, next you can see that cryptomenoria and dysmenorrhea. What is cryptomenoria and dysmenorrhea? Here you can see that cryptomenoria means that, okay, here the cryptomenoria means the menstrual blood is formed but cannot come out due to blockage. If the blockage will be there, means that will not be a proper flow will not be there. There will be a blockage, that we known as cryptomenoria. Next one, dysmenorrhea. It is a painful menstruation without a normal flow. That is painful menstruation with normal menstrual flow will be there. Next one, retroversion and retroflexion of uterus. What is that? Retroversion and retroflexion. Retroversion means the whole uterus is tilted backward towards the spine. The uterus is tilted backward towards the spine. That is important, tilted backward to the spine. Retroflexion means it's only the upper part of the body of the uterus and it's bent backwards while the cervix stays in normal position. Okay, next one, primary infertility and secondary infertility. What is that? Primary infertility and secondary infertility. Primary infertility means a woman has never become pregnant. That is the primary infertility. Secondary infertility means a woman has been pregnant before but next time it is unable to conceive again. Okay. Next one is choose the correct answer. Here you can only write the answers. Don't waste your time while writing the entire questions or the options. Okay. First question. Precipitate labor means when combined duration of first and second stage labor is less than, here the options, 4 hours, 2 hours and 6 hours. The answer will be 2 hours. Next, manual removal of placenta is done under which anesthesia? Here you can see the options, that is spinal anesthesia, general anesthesia and local anesthesia. Okay, so here the answer is general anesthesia. Okay, here the answer is 2 hours. Okay, next we can see that normal fetal heart rate is, here we can see that 3 options, 80 to 120 per minute, 120 to 160 per minute, third one 140 to 180 per minute. So the answer is 120 to 160 per minute. Okay, next question. Polyhylatic metragen is administered after the delivery of, first one baby, second one anterior shoulder and third one is posterior shoulder. So here the answer is anterior shoulder. So we can move for the last question. The type of forceps which is applied when the fetal head is at pelvic outlet, that is Wrigley's. Here the options will be there, that is long curved, Wrigley's and Killian's. But the answer is Wrigley's. Okay, next we are going for the short notes of the following or the short answers. Care of woman during oxytocin infusion. What is the oxytocin? It is a drug that is used for the contraction. Okay, here we can see that 10 points you can see. So we can see one by one. First one is monitor uterine contraction. You want to see, first monitor the uterine contraction. Observe frequently duration and intensity of contraction. Stop infusion if contraction are too strong and too frequent, more than 5 in or 10 minutes. Okay, next, second one, monitor fetal heart rate. First we want to monitor uterine contraction. Next we want to monitor what is that fetal heart rate, FHR. Check FHR every 15 minutes or continuously using CTG. Stop oxytocin if fetal distress occurs. Next one, monitor maternal vital signs. What is that? First we will monitor uterine contraction. Second one is fetal heart rate. The third one is maternal vital signs. What we want to record in maternal vital signs is that record pulse will be there, blood pressure will be there, and temperature. The three things, pulse, pressure and temperature, we want to check regularly. Watch for signs of water intoxication or hypotension. This also want to watch for this monitoring. Okay, next one is assess progress of labor. Progress of labor you want to assess. Monitor cervical dilation and descent of the presenting part. In the present part or the cervical dilation we want to assess. That is the assess progress of labor, timely or secondsly. Okay, next one is regulate oxytocin drip rate. Okay, start with low dose and increase gradually as per protocol. Use an infusion pump for an accurate control. For the accurate control you want to see, start with a low dose. You want to start for the low dose and increase gradually by the protocol or the prescription of the doctor. We can use or make it is more than, and use the infusion pump for the accurate control. Accurate control, we can see that good thing. Okay, next point we can see that ensure proper IV fluids. Ensure proper IV fluids. It means that use normal saline or Ringer's lactate. That is never plain glucose. It's not a never plain glucose. That is normal saline or a Ringer's lactate. Okay, RL. That we were giving for this patient, for this woman, for the ensure proper IV fluids will be given. Next one, seventh one, observe for complication. We want to observe, is there any complications, is there or not. Watch for uterine hyperstimulation, rupture or fetal distress. This is observed for the complication. Next, eighth one, provide emotional support. We want to give an emotional support to the patient or the pregnant woman. That is, reassure the woman and keep her informed about the procedure. Please keep on telling the procedures that we are going to do for that mother, and we can provide an emotional support to that pregnant lady. Okay, next one, that stop infusion immediately if uterine hypertonus, fetal distress or severe pain occurs. If the mother having fetal distress or severe pain, it will happen, means we can stop the infusion immediately. Okay, because the labor will start. Okay, the contraction only we were using the oxytocin. So here the severe pain will occur, means it's going for the labor. So we can stop the infusion immediately. Next, 10th one, last point, what is that? Document all findings. We can find all the documents, record infusion rate, maternal and fetal observation, and any interventions. That way that we can document or file it, all the things. So once more we can tell what all are things. So care of women during oxytocin infusion, that is first one, monitor uterine contraction. The three things have to monitor. First one is uterine contraction, second one is fetal heart rate, third one is maternal vital signs. Next one, assess the progress of labor. Next one, regulate the oxytocin drip state. Next one is ensure proper IV fluids. Next one is observe for complication. Next one is provide emotional support to that lady and stop infusion immediately. And if fetal distress or severe pain will be happen. The last one is document all the findings. This is the care of woman during oxytocin infusion. Okay, next we are going for the second one, that is missed abortion. What is that missed abortion? Missed abortion means that baby inside the womb has died, but it's not expelled naturally. Missed abortion means if the baby inside the womb, it has died, but it's not expelled naturally. That is known as missed abortion. Here you can see the 3 points. The woman may not have bleeding or pain. Maybe the woman may not have the bleeding or pain, or the pregnancy symptoms disappear, or the uterus stop growing. That is the things, that is the causes where the missed abortion will happen. Next one is confirmed by ultrasound. We can confirm it by ultrasound. No heartbeat will be seen. Okay. Next, what all the treatments we want to give? Remove the dead fetus by medicine or DNC. Give antibiotics and provide emotional support. Emotional support is the necessary thing that we want to give for the mother. Okay. So next one is so here this almost having the missed abortion. What define the missed abortion? How we can confirmed by the missed abortion? How we are treating this missed abortion? Okay. So these all are the answers. Next we are going for the next side, but that is episiotomy. Episiotomy is a procedure. First thing I want to give that episiotomy is a procedure. Episiotomy is a small surgical cut made by the perineum area between the vagina and the anus during the childbirth to enlarge the vaginal opening and to help the baby come out easily. Okay, it is the episiotomy. It is the procedure that we are giving for the lady, that the baby is during the childbirth to enlarge the vaginal opening. We want to cut the vagina and the anus. We want to cut that part, that cutting part of the surgical procedure we are known as episiotomy. Okay, here we can see the purposes. Why this all things we are done? To prevent the tearing of the perineum. If the baby is coming out, means normally there will be a chance to tear the perineum. So if we are cutting, means it is the it should be prevent. Okay, to prevent the tearing of the perineum. Next, to shorten the second stage of labor. It will shorten the second stage of labor. In the second stage of labor, what will happen? The placenta will be coming. Okay, so it will be shortened the second stage of labor. Next, to help in difficulty in delivery. If in difficulty of delivery, it will happen. It is simply it will delivered. Okay. Next, what all are care we want to give for the episiotomy? What all the care? Keep the area clean and dry. First, we want to before doing the procedure, we want to keep the area clean and dry. Next one is, first one is keep clean and dry. Second one is give pain relief. Any pain relief medication we can give for that people. Okay, sorry. Okay, next, observe the bleeding or infection. Bleeding or infection, we can observe any bleeding or infection. You see that if any bleeding or infection is there or not. Okay. Next one, encourage the mother to do perineal care and pelvic floor exercise. For encourage the mother to do perineal care. Perineal care, after the postnatal delivery, you want to care the perineal area and the pelvic floor exercise you should do. So this all are the care we want to give after the episiotomy. Once again, I want to tell that episiotomy is a small surgical cut that made by the perineum area between the vagina and the anus. That is to why we are giving this one. This is to enlarge the vaginal opening and help the baby to come out easily. So that is the episiotomy procedure. Next, we are moving for the fourth question, high risk pregnancy and its management. What is high risk pregnancy and its management? So here we can see that a high risk pregnancy is one in which the mother or baby has higher chance of health problems before, during or after delivery. Sorry. That means that a high risk of pregnancy in which mother or baby has higher chance of health problems. If there is higher chance of health problems, if the mother having for the before or during or the after delivery, if the mother having or the baby, in which one the mother or the baby has higher chance of health problems. Is here we are highlighting that health problems that we are known as high risk of high pregnancy. So here, what are the causes, what are the risk factors we can see? If the mother age below the 18 or above 35 years, there is a chance to get high risk of pregnancy. Or the high blood pressure, diabetes, anemia. If the mother having high blood pressure, diabetes or diabetic mellitus or anemia, if this all are the condition also, it will causes the high risk pregnancy. Next one is multiple pregnancy, or the multiple means twins or triplets. It will also get the high risk of pregnancy. Next one, previous miscarriage or cesarean, C-section. If the mother having the second miscarriage will be there, or missed abortion will be there, or the C-section were done by the mother. So this all are the other risk factors or the high risk pregnancy things. Okay, next one is poor nutrition or infection. If the mother having poor nutrition or infection, also having the high risk of pregnancy. Next we can see that it is also having management having 3 or 5 marks. So you can elaborate your answer. This is the short forms, you can elaborate by your own. Okay, first we can see that regular antenatal checkups you should do. What is that? Regular antenatal checkups you must do. Next one is early detection and treatment of problems. If we are detecting it is in early, we can treat the problems. Okay, next one is healthy diet and rest. Healthy diet and rest should be given to the pregnancy management. Okay, next, avoid stress, smoking, alcohol and drug. Avoid stress, smoking, alcohol and drug. This is the another management that we are giving for the mother. Okay, next one is hospital delivery with skilled doctor and nurse. That is the hospital delivery with a skilled doctor and the nurse we are giving. And hospital delivery with a skilled doctor and nurse. Next one is continuous monitoring during labor and after delivery. We want to continuous monitoring, we want to give to the mother for the labor and after delivery baby also. Okay, so this is the high risk of pregnancy and the management. Okay, next we are moving for the structure and diameter of female pelvis. It is very important question. If it is not asked by the question also, you should know this answer. Okay, this is that much important, structure and diameter of the female pelvis. So here, what is the structure? This female structure is a broad, shallow, around to help in childbirth. This is, you can see in the picture, we can see that female pelvis. This is a broad picture. It is first thing, it is a broad thing. It is a broad thing, and this is a shallow, and it's a round shaped pelvis is there. So we can see in a round form, that is known as female pelvis, broad, shallow and round in childbirth. It is made up of 4 bones. What is that? 2 hip bones will be there. So here you can see that 2 hip bones will be there. This is 2 hip bones will be there. This is known as 2 hip bones. So 2 hip bones. Next one is sacrum. What is sacrum? This is sacrum. This position is known as sacrum. Next one is coccyx. What is this? This is coccyx. So you can see that 2 hip bones will be there. Then 1 sacrum will be there. Then 1 coccyx. Okay. You can see once more. I will show it is, that is more clearing about you. So you can see that 2 hip bones will be there. This is 2 hip bones will be there. Then this we called as sacrum will be there. Then this part that is known as coccyx. So 3 parts will be there for the 4 parts, because 2 hip bones we are adding. 2 hip bones, 1 sacrum and 1 coccyx will be there. Okay, next we are moving for the parts of pelvis. There is 2 parts, false pelvis and true pelvis. False pelvis is that upper part that support abdominal organs. So we can use this at upper part. Upper part we were using supports the abdominal organs. Okay, next true pelvis, it is the lower part that forms in the birth canal. That is the lower section. Okay, lower part that forms to birth canal. Okay, next we can see that important diameters of true pelvis. So here we can see that important diameters, anterior posterior diameter it will be 11 centimeter, transverse it is 13 centimeter, and oblique diameter it will be 12 centimeter, and anterior posterior diameter will be diameter of outlet will be 11.5 centimeter, and transverse diameter of outlet is 10.5 centimeter. So here we can explain it is, what is anterior posterior diameter? What is that? 11 centimeter. Anterior posterior means distance between the upper border of the pubic symphysis, that is front bone, and the promontory of the sacrum, that is the backbone. It shows the front to back space in the pelvic inlet. Inlet, you know, the inlet and outlet you should know. So in that, the front to back diameter, that will showing that 11 centimeter. Okay. Next you can see the transverse diameter. How we will show this transverse diameter? That is 13. Okay, here the widest distance between the two sides of the pelvic brim. So pelvic brim, two pelvic brim, the widest distance. So here the distance, this distance will be the 13 centimeter. It shows the side to side width of the pelvic inlet. Inlet means inside. Inlet, this round we were called that inlet. So that will be the widest distance between the two sides of the pelvic brim. It shows the side to side width of the pelvic inlet. Next one is oblique diameter. What is oblique diameter? Oblique, it is 12 centimeter. It is the distance between sacroiliac joint on the one side and the iliopectineal eminence on the opposite side. So it is the distance between sacroiliac joint on the one side and the iliopectineal eminence on the opposite side. It rises diagonally. It goes by diagonally. Okay. It is the diagonal cross. Okay. Diagonal cross will be there. Diagonal cross across the pelvic inlet. So that will be 12 centimeter. Next we can see that anterior posterior diameter of outlet 11.5 centimeter. How we can see that anterior posterior diameter of outlet 11.5 centimeter? It is the distance between lower border of the pubic symphysis and the tip of the sacrum. That we known as the distance between the lower border of the pubic symphysis and the tip of the sacrum. That we known as that distance is known as 11.5 centimeters. Okay. It shows the front to back space at the pelvic outlet. Before we are discussed about pelvic inlet. Here we are discussing front to back space of the pelvic outlet. Next one is fifth one, transverse diameter of outlet. What is the transverse diameter? We can see that 10.5 centimeter. It is the distance between inner borders of the ischial tuberosity, the bones you sit on. You sit on that we are known as the bones that we sit. That is known as ischial tuberosity. The inner borders of the ischial tuberosity is known as the distance between the inner borders of the ischial tuberosity. That is the bones you sit. It shows the side to side with the outlet width of the side to side, that we known as the 10.5 centimeter. Okay. So next here we can say that the female pelvis is wider, rounder and shallower than the male pelvis. It helps the childbirth. Female, it will be the childbirth. So that's why the female pelvis will be wider than the male one. Okay. I think that it is understood by you. And we can go for the next one. It is the right long essay of the following. So we can go for the long essay questions. So here our first question is, what is a preterm baby? What are the clinical features of preterm baby? Explain the nursing management of preterm baby. Here you can want to concentrate how much each question carries how much marks. According to that you want to fill the answers. Okay. Here you can see that what is preterm baby. Here we can see that answer. A preterm baby is a baby who is born before 37 completed weeks of pregnancy or less than 259 days from the first day of the last menstrual period. So we can see that preterm baby means before 9 months the delivering of the baby, that is known as preterm baby. Here we can see the before 37 completed weeks, that is known as preterm baby. Next we can say what are the clinical features of preterm baby. So here we can see what are the clinical features. It is the low birth weight. It is usually less than 2.5 kg. Thin and small body will be there. It is the clinical. It is the one clinical symptom. Thin and small body will be there. Large head in proportion to the body. Not will be in the proportion the head and the body. It will be large head in the proportion to the body. Next one is skin is thin, reddish and transparent. Here maybe the skin is thin, reddish or transparent will be there. Less body fat will be happen, that appears wrinkled. Next one is soft ear cartilage will be there. Maybe it is not fully grown, that is ear bend easily. So the ear can bend easily. So that is the thing. Then the weak cry will be there, poor sucking will be there, because the baby is not fully termed, it is pretermed. Then the next poor muscle tone will be there, floppy body will be there. So poor muscle tone will be there. Next one is irregular respiration or apnea will happen for the baby. Irregular respiration or apnea will be happen. Next one is temperature instability. Instability will be happen, gets cold easily. So the baby get cold easily. Okay, temperature instability will not be there. Maybe according to the medical condition, preterm baby, all we were get in a incubator. Otherwise, they can't cooperate with our external environment. Okay. Next, we are moving for the third question. Explain the nursing management of a preterm baby. So here we can see the nursing management. One by one we can discuss. Okay, nursing management of preterm baby. First one, maintain body temperature. How we will maintain the body temperature? Keep the baby in incubator or under the radiant warmer. Radiant warmer or the incubator we were using for the preterm baby. Next one, use warm clothes and blanket for body temperature. Okay, use warm clothes and blanket. Next, avoid frequent exposure. Avoid frequent exposure we want to avoid. Next one, maintain airway and breathing. Maintain a proper airway and breathing for the baby. Okay, ensure clear airway, give oxygen if needed, observe for apnea and cyanosis. Cyanosis means bluish discoloration. Cyanosis means bluish discoloration. Okay, this all we were checking, the maintain airway and breathing. Okay, next one we can see that maintain nutrition. Nutrition we want to maintain, that is start breast milk. Start breast milk, preferably mother's milk, by spoon or tube if baby cannot suck. If baby cannot suck, it will provide like spoon. Okay, next one is small and frequent feeds should be given. Small and frequent should means proper frequent or small frequent feeds should be in the if half an hour like that. Proper timing should be given for that frequent feeds. Next one, monitor for vomiting or abdominal distension. Any vomiting tendency or abnormal distension happening or not, we want to monitor. Next one is prevent infection. How we will prevent? Maintain strict hygiene and use sterile equipment and limit visitors. These all are the how to prevent. First one, maintain strict hygiene should be done and use sterile equipments you should be used and limit visitors. If the preterm baby, we want to limit the visitors. Okay. Next we can see that monitor vital signs. How we ever monitor vital signs? Check temperature, respiration, heart rate regularly and observe for any abnormality sign. Next one is provide skincare. How we will provide skincare? It is handle gently, avoid frequent bathing and keep skin clean and dry. This all are the skincare that we can do for the baby. Next one, parental support and education we want to give for the mother. Okay, teach kangaroo mother care for the parent. Then encourage boarding and breastfeeding. Bonding and breastfeeding you want to encourage and explain home care after discharge. These all are the parental support and education that we are giving for the mother. Okay. So this all are the nursing management of a preterm baby. Next we are moving for the second question. Define abortion. Explain the various types of abortion. So here we can see what is abortion. Abortion is the expulsion or removal of the product of conception from the uterus before the fetal is viable. That is before 20 weeks of gestation or when the fetus weighs less than 500 grams. So that is the abortion means it is the expulsion or removal of the product of conception from the uterus before the fetal is viable. That is before 20 weeks of gestation or the fetus weight less than 500 grams. So here we can see the types of abortion. This is the second question, types of abortion. First one is spontaneous abortion, that is miscarriage. It is occurs naturally without any medical or surgical interference. No, it occurs naturally or without any medical or surgical interference. So here we can see the types. First one is threatened. Bleeding but cervix is closed. Bleeding but cervix is closed. Pregnancy may continue. That is threatened abortion. That is inevitable. That is bleeding with open cervix abortion cannot be stopped. That is inevitable. Next one, incomplete. What is incomplete? Some products are expelled, some are retained. So some products of the fetus that is retained there. So that is incomplete abortion. That next one is complete abortion. What is that? All products expelled, uterus empty. Uterus will be empty. That is complete abortion. Next one is missed abortion. Fetus dead but retained in uterus. Fetus is dead but it will be retained in the uterus. That is missed abortion. Next one is septic abortion. What is that? Infection present in the uterus following abortion. Any infection will be present in the uterus, that following the abortion, that is known as septic abortion. So these all are the important abortion types of abortion that we can see once more. That is threatened abortion, inevitable abortion, incomplete abortion, complete abortion, and missed abortion, and the last one is septic abortion. So that is the meaning of various. This is all about the abortion. So here we can see one by one. Okay, before we can see it is that in the spontaneous abortion we were seeing the small types. Next we can see that types of abortion. First one is induced abortion. What is induced abortion? That is termination of pregnancy by medical or surgical method. This is the terminating the pregnancy by medical or surgical reasons we were giving induced abortion. Okay, this is the termination of pregnancy by medical or surgical method. Here also we can see that two types. In that we can see that types. Here also we can see the types. That is two types. That is therapeutic abortion and the elective abortion. What is that therapeutic abortion? It is done to save mother's life or prevent serious illness. That is known as therapeutic abortion. That is done to save mother's life and to prevent serious illness. So that is known as therapeutic abortion. Next one is elective abortion. What is that? Done on woman's request within legal limits. In the legal limits we were doing that elective abortion. Next, third one, habitual or recurrent abortion. What is that habitual or recurrent abortion? It occurs when a woman has 3 or more consecutive spontaneous abortion. So if the mother having consecutive or spontaneous abortion will happen, that we known as habitual abortion. Next one is septic abortion. What is that septic abortion? Abortion associated with infection. Septic means that infectious. Okay, abortion associated with infection of the uterus due to unsterilized procedure. Okay, so this is the septic abortion. So this we are discussed about the abortion. This all are the types of abortion. Next we can see that define multiple pregnancy, list out the causes, signs and symptoms of multiple pregnancy, explain the antenatal management of multiple pregnancy. So first we can see that what define multiple pregnancy. What is multiple pregnancy? Multiple pregnancy is a condition in which 2 or more fetus develop simultaneously in the uterus. In the uterus, we can see that 2 or more fetus that will develop simultaneously in the uterus. Example, we can see that twins, triplets, quadruplets. Okay, this all we can see that multiple pregnancy. Next one, list out the causes, signs and symptoms of multiple pregnancy. What is that? Causes, signs and symptoms of multiple. Here we can see the causes. First one, fertility drug or ovulation, which is the one of the cause that we can see for the multiple pregnancy. Fertility drugs or the ovulation induction. Next one, hereditary tendency will be the hereditary family history of twins will be there. So it will be the hereditary tendency. Next one is advanced maternal age. Advanced maternal above 30 years. There will be also an advanced maternal will be 30. Next, race and nutrition. More common in well-nourished women. For a well-nourished woman, there will be race and nutrition. Okay, next one is previous multiple pregnancy. If the mother having previously also multiple pregnancy, there is a chance to get another multiple pregnancy again. So these all are the causes and signs symptoms of multiple pregnancy. Next we are using here we are discussing about the causes. Next we are discussing about the signs and symptoms of multiple pregnancy. So here you can see the signs and symptoms. What is the signs? Larger uterus than expelled for gestational age. It is the larger uterus will be there because there will be twins or triplets will be there. So large uterus than expelled for gestational age. Next one is excessive weight gain will be there. Excessive weight gain will be there because 2 or more child there will be there. So there should be an increment in the weight gain. Okay. Next one, increased fetal movements will be there. Next, 2 fetal heart sound heard in the different areas. We can see the 2 fetal heart sounds heard in different areas. Then the ultrasound confirms more than 1 fetus. Ultrasound scanning we can confirm that more than 1 fetus or not. Next one, mother feels more tired and breathless. Breathless will be there. Mother having tired also will be there. Okay, next one is over distended abdomen and shortness of breath also will be happen for this signs and symptoms. Next we can see that explain the antenatal management of multiple pregnancy. We can see next we were going for the antenatal management. So here we can see that antenatal management. Here we having the 7 steps will be there. So you can see the management one by one. Here you can see the first one, frequent antenatal visit will be there. That is regular checkups to monitor both mother and fetus. Watch for signs of preterm labor or pre-eclampsia. Next one is nutritional care. In that you can write high protein, iron and calcium rich diet will be there. Iron and folic acid supplements will be there. Adequate hydration and rest should be there. Last one, prevent complication. How we will prevent? Observe for anemia, hypertension and edema. Avoid over retention. Okay. Next one is monitor fetal growth. That how we will control regular ultrasound to assess growth and position of babies. Advise adequate rest will be there. That for that first one, monitor fetal growth. Second one is advise adequate rest. That is mother should take the left lateral position to improve uterine blood flow. Next one is prepare for preterm delivery. That is that keep neonatal resuscitation team and equipment ready. That is the first thing. And the second one is hospital delivery is preferred. Then the last one is psychological support. It is the important thing that we want to give, that is psychological support. Give reassurance and health education to reduce anxiety. To reduce anxiety and health education, we want to give a psychological support to the parent. Okay. So we are going for the next question. Define placenta previa. List the types of placenta previa. Explain the management of placenta previa. So here the first question is define placenta previa. What is placenta previa? Placenta previa is a condition in which the placenta is implanted in the lower part of the uterus, partially or completely converging the cervix. It is the condition in which the placenta is implanted in the lower part of the uterus. It is implanted in the lower part of the uterus. It is partially or completely converging the cervix. That is placenta previa. It is common cause of painless bleeding in the later months of pregnancy. It is usually 28 weeks. You can see. Okay. So here we can see the types of placenta previa. There are 4 types will be there. We can see that. That is low-lying placenta. First type is low-lying placenta. It is a placenta is implanted in the lower segment but does not reach the cervix. That is the first one, that is low-lying placenta. Second one, marginal placenta previa. That is that placenta reaches the margin of the cervix but does not cover it. That is the marginal placenta previa. Third one, parietal placenta previa. What is that parietal placenta previa? That placenta parietally covers the or partially covers the cervical opening. It partial placenta previa means placenta partially covers the cervical opening. Next, last one is complete or central placenta previa. What is that? Placenta completely covers the cervix. So cervical. Okay. So that is the thing. Complete placenta previa means placenta completely covers the cervical. Okay. Next one is the management of placenta previa. What all the management we want to give? First one is antenatal management will be there, intrapartum management will be there, postpartum. Here if it is related to mother condition, we can see that prenatal, intrapartum and postnatal you can see. So here we can discuss about the first one, prenatal, antenatal. Okay. Antenatal before delivery management. It is the hospitalization of bleeding will be occurs. Bed rest in left lateral position will be there. Monitor vital signs and fetal heart rate regularly. Avoid vaginal examination can cause more bleeding. Ultrasound to confirm type and position of placenta. Blood should be cross matched and kept ready. And iron and folic acid supplements to prevent anemia. If the mother having any anemic condition, you can give iron and folic acid supplements to prevent anemia. The next one is corticosteroid may be given to fecal langal maturity of preterm delivery expected. That also you can give corticosteroid or iron folic tablets. So this is the first management that we are giving for the before delivery. Okay. Next one, in the time of delivery, what we are giving, that is intrapartum management. Delivery in the hospital with full facilities for emergency care. If the bleeding is mild or pregnancy is near term, that is cesarean section be preferred. Next one is if bleeding is severe, immediate delivery by C-section and to save the mother and the baby. That is the next. Bleeding is severe. If the bleeding is severe, we can immediately deliver the baby by cesarean and to save the mother and the baby. Okay, next one is postnatal, after the delivery. This is after, before that is antenatal means before delivery, then this is after delivery. Okay, after delivery what will happen? What we all are the management we want to give, that is that observe the postpartum hemorrhage, PPG. Next one is monitor vital signs and uterine contraction. We want to check the monitor vital signs and the uterine contraction. Next, next provide emotional support, and counseling to the parent. Next one, maintain proper hygiene and nutrition. This is the last step we want to give for the mother. Okay, so this all are the management of placenta previa. So next we are moving for the Apgar score. It is the important question. Here the one table is there. It is very important for your future and here also. So you want to by heart the table. Okay, so we can see that what is Apgar score. And next B question, write the immediate and routine cares of full-term healthy newborn baby. So here we can see that also immediate care that we are giving for the patient. Okay, so here we can see that what is Apgar score. Okay, the Apgar score is a quick assessment method used to evaluate the newborn's physical condition immediately after birth. That we can see that in Apgar score. It is done 1 minute and 5 minutes after birth. In the 1 minute or the 5 minutes after birth, we can see that the Apgar score. The baby is scored on 5 signs, that is given in 0, 1 or 2 marks. Maximum score is 10 marks. So this all are the Apgar score. In the criteria we can see that this is the table, that is very important table that you want to study. Okay, so first we were doing that appearance, 0, blue or pale, blue or pale. If the appearance blue or pale means, that is we will give 0 marks. If the body is pink or the limbs is blue, that we will give 1 mark. Completely okay, it will give 2 marks. Next, pulse rate. Pulse rate, it is absent, we will write in 0 marks. If the pulse rate will not be there, that absent, that we will count it as 0. Then less than 100 on minimum, we can write to 1, and less than, more than 100, it is 2. Grimace, that is reflex irritability. No response, we will do as 0. Grimace is 1. And cry or active movement, that we will add it as 2. Next, activity, muscle tone, that limb will be 0. Some flexions will be seen, that we can see in 1. Active movement, that will be 2. Then respiration, 0, that will be absent. If the baby having no respiration, it will count as 0. If weak and regular means we will count it as 1, and good and crying it we will conduct 0. Then we can add, if the, for example, if my baby's appearance is 2, it is completely okay. Next, the pulse rate is less than 100, so we can add it is 1. Then next one, grimace, it is cry or active movement, that is 2, okay, again plus 2. Then next one is activity or the muscle tone, that will be some flexions will be happen, so it is 1. Then last one, respiration, it is good and crying, or the so respiration it is absent, that we can give it 0. So how it will be total? 2 plus 1 3, 6. So here the 6, so my child is in 4 to 6, so it is mild distress. So like that we will count this one, okay. If it is 10 out of 10 or 7 to 10 means it is a normal baby. 4 to 6 means it will be mild stress. Then 0 to 3 means it is severe distress or need immediate auscultation will be. Okay, it will be nude. So this is the UPGAR score while we are adding. So this is the UPGAR score. UPGAR score is a quick assessment method used to evaluate the newborn's physical condition immediately after birth. It is done at 1 minute and after 5 minutes after birth. The baby is scored in the 5 signs. Each can give 0, 1 or 2 marks. Maximum score is 10. Okay. So next we are moving for the right. The immediate and routine care is that full term healthy baby on the newborn baby. Okay. So next question is that one. We can tell one by one. Okay. What is the immediate care? First one is clear airway, suction or mouth and nose. Next one, dry the baby, prevent the heat loss. Next, third one, ensure breathing, that is simultaneously if baby does not cry. Then clamp and cut the umbilical cord under sterile condition. Next one, assess UPGAR score at 1 and 5 minutes. Next, sixth one, maintain body temperature, skin to skin contact will be there or not. Then place under the radiant warmer or the mother chest. KMC must to fever, kangaroo mother care should be given. Then the identification, put ID bands on the baby for the identification. Then the last one is initiate breastfeeding within 1 hour. That is in the immediate care we should given after the birth. This is the first one, immediate care after the birth. Next we can see that routine care. What is the routine care that we can give? Okay, routine care. What is that routine care? In the first one, eye care. Eye care, clean with sterile cotton and apply antibiotic eye drop. Second one is cord care. Keep cord clean and dry and absorb for infection. Then third one, maintain warmth. Use warm clothes, avoid exposure. Last one is feeding, exclusive breastfeeding on demand. Last one is next one is hygiene. Keep baby clean and change diaper often. Then it will be the immunization. Give BCG. Bacillus calmette guinea, that is the BCG vaccine should be given, that to prevent tuberculosis. OPV, oral polio vaccine, that should be given for the poliomyelitis. Next one is hepatitis B. So before discharge, so this all are the immunization that given for the at birth. At birth we were giving these 3 vaccines. Next one, record weight and vital signs daily. Daily we want to check for the weight and vital signs. Next, last one, observe for danger signs. So for example, poor feeding, difficult breathing, fever or jaundice will be there. So we want to check observe the danger signs. So this all the 2 things. One is the one is the immediate care, next one is the routine care. This is the 2 slides we are discussed. So here we are completing all the sections. First we are discussing about all the questions. So here we are completing with the long answers. So please clear all the questions once again. So thank you and have a nice day. Please do your exams well.